Welcome to our third session of YP Speaks, and YP Speaks is a session, a live Google Hangout session that we started a few weeks ago to hear from our members in the Young Professionals Chronic Disease Network about the work that they're doing and to spread knowledge and experiences in the field of NCDs more broadly among our community. And if you're not familiar with the YP-CDN, our mission is to mobilize a global community of emerging NCD leaders to tackle the injustice surrounding NCDs. So today we have Ashley Schram speaking about trade and investment and its impact on non-communicable disease. Ashley entered the doctoral program in population health at the University of Ottawa in 2012. She's a co-investigator on a Canadian Institutes of Health Research funded research project conducting a health impact assessment of the Trans-Pacific Partnership, specifically examining pathways between provisions within trade and investment agreements and key risk factors for non-communicable diseases, including tobacco, alcohol, and diet. Her dissertation work includes a focus on how transnational food corporations and agreements such as the TPP impact the food supply and regulatory policy space to protect and promote healthy diets. So brief background is that this session is very exciting for me and others within the YP network because NCDs and trade is an area of focus of our work. And so in order to drive progress in protecting global public health from trade-related threats to NCD control, we held a forum on trade and health in July alongside the United Nations high-level review on NCDs. And Ashley actually was a speaker at this event, so I'm very excited to have her highlighting how trade impacts non-communicable disease again. And at this event, we launched the Declaration on NCDs and International Trade and Investment, which is a call to safeguard public health in the context of an expanding system of bilateral and regional agreements with their increasing behind-the-border reach into domestic public policy space. And so Ashley is going to tell us a lot more about this and shed some light on what that means. Go ahead, Ashley.
Okay, great. So I'm just going to move over to screen share so I can pull up slides. Okay. Well, thank you, Jordan, for the opportunity to speak today, and to anyone who has taken the time to tune in, whether it's live or later on. In the last YP Speaks, Joe Jewell talked about global food policy and some of the directions for policy action, which I think is a great lead-in for today's talk, particularly because he mentioned at one point the role that trade agreements might have in implementing these policies, which is primarily what I'm going to address today. So my goal is to introduce the World Trade Organization, some key principles of trade, how these agreements relate to drivers of NCDs, and the implications they may have for effective policy and health regulations. I just want to note that I'm going to keep referring to trade or trade agreements, but really what I mean is trade and investment. And really, if anything, new agreements are more to do with investment than trade, but for the sake of brevity, I'm just going to stick with the term trade. I want to start by noting that the idea that trade can impact health is not a new concept. It's long been accepted that the movement of goods and people, and often the vermin that traveled with them, were vectors for the spread of some of the world's deadliest diseases. So trade routes were connected to the spread of the Black Death in Europe in the 14th century. A trade ship from China was the source of a cholera outbreak in Latin America in the 90s. And even now, with the current Ebola outbreak in West Africa, people have become much more keenly aware of the role of trade. People fearing contaminated cargoes, wanting borders locked down, etc. And despite the fact that there's been exactly one death in America from Ebola, last I checked, and despite the fact that over the next year in America there will be about 430,000 smoking-related deaths, another 300,000 obesity-related deaths, and still another 45,000 deaths because people can't get the health care they need. NCDs just haven't been able to create that same sense of impending doom or hysteria as infectious disease. Nor do they bring to mind the clear connections with trade relations. And what seems less apparent to people is that trade promotes the distribution of some of the leading risk factors for NCDs, namely unhealthy food products, tobacco, and alcohol, and it makes it increasingly challenging to introduce public health measures that regulate these products, all while reducing access to affordable medicines for those living with NCDs. So even though NCDs have been recognized as one of the largest threats to social and economic development in the 21st century, and even as they're projected to be responsible for 73% of all deaths worldwide by 2020, we continue to negotiate progressively destructive trade agreements. So what's the connection between trade and NCDs exactly? To start, there are some indirect pathways, ways in which these agreements modify the environments in which we live that have impacts on the social and structural determinants of our health. And these can include the changes we see in employment conditions, how they change the types and volumes of employment, how they change a government's capacity to collect revenue through trade tariffs, which can reduce their expenditure on health and social spending. And they can also provide health technology transfers and the potential for economic growth. This list of indirect effects, both positive and negative, is much longer than what I have talked about here, but it's not what I'm going to focus on. What I want to address are the direct effects that the specific chapters and provisions have on NCD risk factors and access to medicines. But before I start building the interior of this model, I want to take a step back and do a brief intro to trade. So going all the way back to 1944, as World War II was nearing its end, the Bretton Woods Conference was held to try and figure out how to rebuild the post-war economy and develop better international relations. And the thought was that if our economic success was interconnected, we might be less likely to start World War III, sort of a nations that trade together, stay together. And out of this conference was born the IMF, the International Monetary Fund, and the World Bank. But the imagined International Trade Organization never actually came to pass, and instead we got the General Agreement on Tariffs and Trade, or the GATT, in 1947. And so while the GATT was only ever intended to be a provisional agreement, it ended up serving as the only multilateral instrument governing international trade until the creation of the World Trade Organization. And so the GATT started with 23 founding nations, but there were 123 by the time the Uruguay round of negotiations began, which went from 1986 until 1994, and it resulted in something termed the Marrakesh Agreement, which, among other agreements, established the WTO in 1995. And so there's 6 main parts to the Uruguay round outcomes. The first was the agreement forming the WTO. And then there was 1 part each covering trade in goods, trade in services, and intellectual property rights. And finally 1 part for dispute settlement and 1 part for trade policy review. And this is pretty much still the overarching structure of the WTO today. Now, the GATT section contains several other important agreements and annexes on trade in goods, including the Agreement on Agriculture, technical barriers to trade, sanitary and phytosanitary standards, and a few more which have important implications for food, tobacco, and alcohol trade policy. But so what does trade liberalization actually mean? Principally, it's the reduction or the removal of barriers to trade. And the commitment by nations in the WTO is to seek progressive liberalization. So any new agreement that nations pursue must, by definition, go farther than the last in its efforts towards achieving free trade. And so what then is a barrier to trade? These are generally found in 2 categories. The first are tariff barriers, which are customs duties on imported goods, where trade liberalization includes moving towards their elimination, and non-tariff barriers, which are any other measure that restricts the access of goods, services, or investment into a country. And tariff barriers have been all but eliminated between most countries, with the exception of some sensitive areas. So the larger focus is on non-tariff barriers, what have generally required what we term behind the border measures to address, as generally Easing non-tariff barriers means some form of change to domestic policy rather than simple border taxation. And what these agreements do is govern any government action in the form of legislation, regulation, etc., and important to us, government measures to prevent NCDs if they're thought to breach trade commitments. And the golden rule of trade is that all government measures must be non-discriminatory, and there are two principles that guide this. The first is most favored nation, which means that whatever the best treatment is that one nation gives to any one WTO member nation, it must provide equal treatment to all other WTO nations for any like goods, services, and investments. And the second principle is national treatment, and this is very similar in concept, just that the best treatment you provide to domestic goods, services, and investments, you must also provide to foreign goods and services and investments. And these principles must always be upheld. So any health policy that we might want to implement, even if it gets past all other trade commitments that it might violate for the sake of public health, it must always be non-discriminatory. But since 1995 and the creation of the WTO and the new agreements that went along with it, the WTO has pretty much stalled. There's been pushback from developing nations who want meaningful agricultural trade reform, meaning actually addressing domestic supports to agriculture in the US, the EU, and other developed nations, and the drive by developed nations to continue aggressively liberalizing services while increasing IP protections. And so this is effectively stalemated multilateral negotiations. And the result of this has been referred to as forum shifting. So moving from the WTO, which was a multilateral stage, to a greater focus on bilateral negotiations between two countries, or plurilateral and regional agreements between 3 or more countries. These take on a range of terminology and how they're referred to, and there's some major ones being negotiated right now, the TPP, TTIP, CETA, and TISA. And sometimes these collectively get referred to as 21st century or modern trade agreements. But what they've really resulted in is an increasingly complex web of agreements that can be very difficult to sort out, particularly for those outside of trade policy or trade law. And these agreements tend to contain new types of measures and chapters that are seen to present challenges to health policy regulations, like investor-state dispute settlement mechanisms or regulatory coherence chapters. I think that lays some of the groundwork for a bit of an intro to how trade relations work. And so at this point, I want to start building some of the direct pathways between trade and NCDs, but specifically for the impacts of trade on key NCD risk factors, food, tobacco, alcohol, and also access to medicines. Starting with trade in goods, this is often referred to as a market access chapter, and it contains provisions that seek to reduce or eliminate tariff rates, as well as tariff rate quotas, and remove subsidies and domestic protections that disadvantage foreign goods entering the country. And the effect that this tends to have is to increase the volume of imports into a country and reduce their price. And here we've seen the spread of Western culture into developing countries, pushing products like tobacco, alcohol, and highly processed foods. And this isn't to say that the countries didn't have these before, but transnational companies entering the market can drive the prices down, they can increase the volume, and they tend to bring their mountains of knowledge on marketing and advertising that can drive up consumption. Additionally, there are trade and services chapters, and these seek to open up new sectors for foreign investors and for reducing conditions within those sectors, such as removing caps on the percentage of foreign direct investment, or FDI, allowed. So for example, the first step might be to open up the retail sector in a country, which means that now if a company opens up a retail outlet and the country decides they no longer want foreign ownership in retail, they would then face trade sanctions. And so the first step might be opening, but perhaps limiting the foreign ownership to 49%, and then later on allowing 100% foreign ownership. So that's one way in which services have become liberalized. Vietnam is an interesting case here, who until relatively recently has had a very closed economy and strict rules on FDI, but has now extensively liberalized their services, and just earlier this year they got their very first McDonald's, which served almost 62,000 Big Macs in the first month. And once companies like McDonald's have invested into the economy, it becomes almost impossible to go back on these commitments without incurring large monetary penalties, as we'll see when we get to the ISDS stuff. And it's hard to imagine that the introduction of McDonald's isn't going to have an impact on the dietary health outcomes in Vietnam. So chapters that address market access, services, FDI, they all form the first direct pathway, which largely changes the NCD risk factor supply. So they can all contribute to an increase in the volume and types of unhealthy products entering a country. They can reduce their price and the distance people have to travel to access them. They can impact the quality of the products, and they can impact their desirability through targeted marketing and advertising. Then there are also those behind the border chapters, one of which is the Technical Barriers to Trade, or TBT. And the goal of this chapter is to ensure that regulations, standards, procedures do not create unnecessary obstacles to trade, and that any measure introduced is the least trade restrictive to accomplish its goal. And the one big thing here for health policy is generally labeling. So whether it's plain packaging for tobacco, warnings on alcohol, or traffic light labeling on processed food products, if these measures are going to be challenged, it's most likely going to come from the TBT. And new agreements such as the Korea-US Free Trade Agreement, which many have said is likely to serve as a template for this new chapter in the Trans-Pacific Partnership Agreement, are introducing new definitions of what good regulatory practices are that may make it harder and harder to justify any new policy measure. So sanitary and phytosanitary, or SPS chapter, one of the key concerns here is the growing burden of proof required to implement safety standards. So sometimes health likes to apply the precautionary principle. So even without definitive proof that something is a health hazard, in light of evidence to suggest it might be, we err on the side of precaution and increase restrictions. As in the well-known case of the EU banning hormone-treated beef from Canada and the US on what they believed was sufficient evidence to suggest it might be a health risk. We need to be able to regulate, even without 100% certainty and proof, but this is likely going to become increasingly difficult. As well, the new agreements are starting to form something called a regulatory coherence chapter to facilitate the ease of trade and ensure that regulation isn't getting in the way of that. This chapter would include rights for private industry to have input into public policy making, and for governments to provide regulatory impact statements and give notice well in advance of any regulation coming into effect. And the thought here is that anytime industry is involved in setting policy, it will emerge less effective, and that these additional requirements will lead to lighter regulation. Lastly, the intellectual property rights chapter, which seems to get most of the attention in the media, and probably for very good reasons. Draft texts of the TPP that have been leaked propose lowering the bars of patentability, introducing patents for medical procedures, increased data exclusivity, and patent term extensions, among many others, but all of which can generally be simplified to actions that delay the entry of generic drugs to the market, which keep drug costs higher longer, reducing access to medicines. If the other pathways perhaps seem too indirect for some or too full of ifs and maybes, this chapter makes it quite clear whose interests are being protected. The IPR draft chapter in the TPP is a loaded gun, and it needs to be stopped before it's too late. So these chapters all have an impact on what we call policy space. So that's the freedom, scope, and mechanisms that governments have to choose, design, and implement public policies to fulfill their aims. And all of the changes to the chapters have the potential to reduce that space for governments to regulate the generally increased supply of processed food products, tobacco, and alcohol, and to ensure that citizens have access to essential medicines to treat NCDs. And the last piece of the puzzle has to do with dispute settlement. There are two types. The first is state-to-state, and this is a process in the WTO, and I believe that all bilaterals and regionals contain this option as well. If one state believes that another has violated any of their trade commitments, they can begin a dispute process. This was generally the only option that used to be available, and if a company had a trade issue, they would have to convince their government to initiate a dispute on their behalf. But investor-state dispute settlement, or ISDS, completely changed the game. This began with NAFTA and is now included in a number of bilateral and regional agreements. ISDS is not included in the WTO dispute settlement process, and what it does is allow investors to directly bring a dispute forward when they feel a state has violated a commitment. And so what sort of rights do investors get? They differ between agreements and the exact wording used, but there is a general set of rights, including fair and equitable treatment, compensation in the case of direct or indirect expropriation, national treatment and most favored nation, which we talked about earlier, but also freedom from performance requirements, which can actually negate some of the positive impacts that we associate with trade, like technology transfer or local development by requiring a certain volume of inputs to be purchased in the local economies. The first two are what seem to come up the most often in arbitration, so I want to quickly look at those. What seems to matter more than what's actually written in these agreements is how the tribunals choose to interpret them. To say that they are subjective would probably be an understatement. What fair and equitable treatment has been interpreted to mean in the past is that government measures cannot affect the basic expectations or representations that were taken into account by the foreign investors when deciding to invest, and that they know all the relevant rules and regulations before investing. So granting these types of rights to investors is irrational for more reasons than we have time to cover here, but unsurprisingly, this has become sort of a catch-all clause frequently used in ISDS cases. And with claims under the fair and equitable treatment succeeding where claims of expropriation or non-discrimination and others have failed. Indirect expropriation is another concerning clause that even though the government has not directly seized legal property, which would be direct expropriation, they've taken a measure that has adversely affected the investment. In deciding if indirect expropriation has taken place, the tribunals seem to utilize one of three tests: the sole effects test, where the intended purpose of the measure is irrelevant, and how it's impacted the investor is really all that matters. They can use proportionality, where there should be a balance between the burden it places on the investor and the benefit it brings to the public. Or they could use police powers, which would suggest that as long as the measure is non-discriminatory and taken in good faith to protect public welfare, it cannot amount to expropriation. So if this third test was the one that was always implemented, regulating would probably be a lot easier. The problem is we just don't know what the tribunal will do. And ISDS is a growing problem. The number of cases continue to rise, and a general assessment has been that the claims investors are making are more outrageous, that the monetary compensation they're requesting is getting higher, and that the percentage of claims found in favor of the investor are rising. So for example, in 2012, the largest amount ever was awarded to an oil company, Occidental, against Ecuador in the amount of $1.77 billion, an amount roughly equal to their annual spending on healthcare in the country. And after Ecuador terminated their contract when Occidental violated its terms. So another problem, as if there needed to be any more, is that even if a country wins, they're generally still stuck with huge legal fees, around $8 million on average per case, and no guarantee of having these covered. And this contributes to the last problem I want to talk about, which is that the threat of ISDS is often enough. The legal fees just to fight can often be overwhelming for a state. Single cases have been recorded to cost upwards of $30 million. And this has contributed to something that's known as regulatory freeze or regulatory chill. And this can involve policymakers watering down their intended policy to avoid ISDS, such as Thailand, after being pressured, decided not to implement traffic light labeling on processed foods and instead just added a message saying children should consume less and exercise for better health. It can also cause states to delay policies until they see how an ongoing ISDS case turns out, such as New Zealand, who is waiting for the resolution of the Australian lawsuit before passing their own plain packaging laws, or abandoning the policy altogether, as Canada did back in the 90s when we were threatened with a NAFTA dispute if we passed plain packaging rules on tobacco. And so this brings the last element into the model of how chapters and provisions within trade and investment agreements impact the supply of food, tobacco, alcohol, and NCD medicines, the policy space we have to regulate around them, and the chill and regulatory measures out of fear of dispute settlement. And I want to end on a slightly more positive note, that there is a lot of really great work happening in this area. People who are exposing draft chapters, publicizing and analyzing the issues, working toward more protective language within ISDS. And if you are interested in what's happening in the world of trade and NCDs, I would suggest you head to Google Communities, check out the NCD trade group, and join the conversation. I'm going to try and get back to the screen.
Thank you so much, Ashley. At this point, any viewers that are not on the discussion, you can submit questions in the Q&A box. And do we have any questions from our participants here on the call?
I guess my question would be, there's a lot of detail that you've brought up, and I'm wondering where the spaces for connections are. So a lot of health conversation goes on within the within the WHO. A lot of trade goes on within the WTO. Where are the places and spots for connecting these things?
I think that that's kind of what we're trying to work on right now, is building those connections, is taking the people that have expertise in trade policy, people that are engaged in the area of NCDs and health, and trying to connect the two. I think we see it to a certain extent already in academia, people starting to study the health impacts of trade, and some civil society organizations as well who have made that their focus. So I think it's starting, and that hopefully we're a part of building those connections.
So there's no formal place at the moment. I guess maybe with UNCTAD or within, like, anywhere formally within the UN system?
Yeah, I think there's a couple. I mean, some of the organizations address it, and there's even been joint publications from the WTO and the WHO. But I don't know if there's any sort of organization that approaches the two with equal footing and actual, a large enough voice as the two organizations independently. Yeah.
Mm-hmm.
Ashley, this is a really, really great discussion and a really dense topic that I think we would require a lot of study to fully understand what's happening in many aspects. But I think what you've highlighted quite nicely is that we can't achieve the goal to reduce premature mortality of NCDs by 25% by 2025, which is the global goal set by the World Health Assembly in 2013, if we don't tackle some of these barriers to trade, in countries are struggling to implement policies that are required. And in the global discussion, there's a lot of focus on the fault of the individual in terms of risk factor control, and how can we shift this discussion from the individual to a systems level?
Yeah, that's a great question. Yeah, I think it's partially just the way we have to approach the situation. There's always going to be that pressure from industry, who are more outspoken, who have more resources, who are going to be able to beat out our voice, right? And they want to keep the focus on individual level decision makings because it takes the spotlight off of them and what they're doing. So I think that it's about changing the nature of the game and the way we talk about it in articles, the way that we're, trying to create activism around this area and really switching the lens to the environment in which these individual or quote-unquote individual decisions are being made, right? So when people don't have equitable access to affordable, healthy food, you know, can we say that that was an individual choice? Or when, you know, you have these really brilliant marketing and advertising efforts on behalf of large transnational tobacco companies, can we say that the individual had made a fully informed choice at that point? So I don't know. I mean, I don't think I have an all-encompassing answer to that question. I think it's going to take a lot of time and a lot of reorienting of the position and just trying to focus on the structural determinants in which those, you know, supposed individual decisions are being made.
I'm very late. I just realized the time. But my question, did you come up with that conceptual framework?
Yes.
Okay. Do we have access to that potentially?
I think that I could share the slides with Jordan.
Yeah, would that be okay?
Yeah, and it came, I shouldn't say, like it's out of some work that's been formulating between a couple of research groups and has been sort of modified through over time to look like that. So
no, it's great. It's wonderful. It lays it out really well, especially for people that don't have that sort of nuanced, detailed understanding of trade. And I think it's a very important, hugely important sort of sector to understand about the pressures that are on governments to balance all of these different things when they're going forward with their policy making and budget allocations and stuff. And I know that within the CARICOM community, the next area that but you know, a discussion going on with certain people is that they really have to look at trade, what's coming into the countries. So they have these wonderful plans about, you know, these NCD budgets and national plans and increasing exercises and Caribbean wellness days and all this promotion and education. So they've got that covered, but this is that component that is external and internal, and a pressure and huge. So I would love to have access to your work because I don't have the time to do that myself. And it was wonderful. Thank you so much. You really and truly educated me on like details that I need personally.
Yeah, well, great. Thank you. And I'll be back in Ottawa in another month or so. So if you ever want to get together at some point and talk about it, that'd be great.
Great, wonderful. Thank you so much. I'll be in touch online. Okay.
Okay, great. Thanks.
Bye.
Bye.
Yeah, final question before we wrap up is, you know, that the research in this area is just beginning really, and you're involved in that, Ashley. And what are some of the research questions that we need to address? And this is sort of a broad question, but to have the evidence to take, you know.
Yeah, no, I think that's a great question, and I think that it's being tackled from a couple different angles. And one of the things that's really going to matter to people is, I think, the work empirically connecting these pathways. So what we have right now is a lot of theory, a lot of we think that this is how things are happening, and so some of the research that's happening in Australia and Canada is looking at trying to actually quantify those pathways. So can we try to use quantitative techniques to show that trade is actually doing what we are claiming that it's doing? So I think that's one angle, making sure that we can sort of empirically test these pathways. As well, I think there's going to be a lot of work looking at what's actually happening in these ISDS cases. Whether, and also like both state to state and investor state. How are these being used? How is fair and equitable treatment being argued, and how does it relate to health? And I don't think that's something that we have a huge body of work on yet, and it's one of the areas that we're trying to tackle, so that when we talk about investor state and what do we think the potential consequences are, we can do that from a much more informed position, saying this is what happened in this specific case, this is how it was used, and this was the gap that wasn't protected for health policy space. So I think being able to understand how the provisions are actually panning out in the cases will show us maybe where some of the gaps are and what we need to address, you know, at least in future agreements to better protect ourselves.
I do have one more question. So
Okay.
your work does focus more so on food, and so we've been discussing how can we break out of certain, research and advocacy silos in the food community, tobacco control community, alcohol, and access to medicines, which access to medicines has been its own sphere and surely communicated in some ways, but how can we bring all of these groups together? And you had highlighted our NCD trade group for communication, but just wondering if you had any more comments.
No, I mean, I think a lot of the events that YP is running is trying to actually highlight I think the connections between them are just so simple. If you look at something like labeling, it's something that tobacco, alcohol, and food are all going to be addressing. So why not start to address that together, start to use people's knowledge, and yeah, again, like stop, entering this from silos. But I think that just comes from groups like this and, seeing who's doing what and starting to work together. Even if you're working on tobacco and I'm working on food, I think there's a lot of opportunity for engagement there.
Great. Thank you so much for this excellent presentation and for your time. And to all our viewers, thanks for joining us. We will have this session on YouTube available after, and hope you'll engage in the discussion on trade and NCDs further with us over Twitter or through our NCD trade community, which you can request to join. We also have an infographic on trade and NCDs on our website at www.ncdaction.org if you want to go back and check that out. So, thanks again.
Okay, thanks, Jordan.
Bye.